Hi, I'm Dr. David Ring, hand surgeon, orthopedic surgeon at Dell Medical School, University of Texas in Austin. And I've been thinking about for some time, the evidence is strong that mental and social health influence physical symptoms and incapability, and they're related, and they're good opportunities for getting healthier, being able to feel better and do more. But what we're trying to figure out is how to use that information at the point of care with a specific patient. And so we undertook a study looking for a way to give a thumbnail sketch of a person's mindset and circumstances. And we collected measures of unhelpful thoughts, misconceptions about the symptoms, and unhelpful feelings, symptoms of worry or symptoms of despair. We did standard statistical models, which were somewhat useful, but nothing novel, and didn't really give us a way to provide the clinician and patient with a snapshot of where they are in terms of thoughts and feelings about symptoms at a given moment. And then I noticed Trevor Lentz at Duke published a study using their data, similar set of data. They had dichotomized it into certain types of unhelpful thoughts, unhelpful feelings, and then used latent class analysis to come up with phenotypes, which were these sort of clusters of mental health factors, and showed that those were associated with various levels of symptoms and limitations. And so we brought that home, and I showed that to a graduate student. We collaborate with Jacob Thomas, and we figured out we could keep the mental health measures on a continuum and use cluster analysis. And using that, we identified very clear and very useful phenotypes. Some people had low misconceptions, low worry, low despair. Other people had notable misconceptions, low worry, low despair. And then onward, and the final group had high misconceptions, high worry, high despair. It was a small group, 5% of patients, but those are the patients we find important opportunities and sometimes find both the patient and we find frustrating trying to deal with it in a biomedical way. But in any case, this leads to the next step, which will be to provide this information to clinicians and patients at the point of care, so that they can kind of look at where the opportunities lie. There may be opportunities in alleviating physical symptoms through biomedical treatments, but there may also be opportunity to address unhelpful thoughts and unhelpful feelings. And hopefully this simplified at the point of care type of measure will increase how patients and surgeons and specialists work within the biopsychosocial model.